Hello and welcome to LTC News. This week's story is on how to implement a communication tool in long-term care homes. Joining me is Nurse Mira to speak about her experience with adopting implementing technology. Mira?
Thank you for having me. And yes, good practices are essential in the adoption and implementation of change. I remember in my previous position, we implemented a new website to give information to patients and their families on behalf of the hospital, and we faced many barriers. Some of these barriers included not having enough training to learn how to update the new website as part of our job, not having ongoing support after training took place, management not being clear in their communications, and so forth. It was really frustrating to continue doing my job.
Thank you, Mira. That sounds very frustrating. Thankfully, we have the Change Management Specialist team, SSMV, to speak about ways to mitigate these barriers.
Thank you for having us. And yes, Mira, those are all barriers we see come up time and time again when trying to adopt and implement change in healthcare. This is why we recommend organizations to use the Change Management Framework by CIHI. And in the case of CityLab, we highly recommend its application. This framework helps to address the role-specific needs for individuals as they transition from present to future state. The framework consists of the 6 key elements shown here, and I will now pass it to my coworker Sandeep about how to apply this framework to the CityLab implementation.
Thank you. In case of CityLab, the implementation should include elements as discussed before. For the workflow analysis, analyze the processes and key activities involved in communicating with the relatives. Map each staff member to their respective roles and responsibilities in this communication. For stakeholder engagement, CityLab should define the needs of staff involved in facilitating communication. In other words, define and address the facilitators and barriers to use this website. For governance and leadership, we propose CityLab should create an implementation task force which involves a staff representative from every domain. Now Macbeth will continue with following steps. Thank you.
To continue, communication. CityLab should formally make staff aware of the new website, change in workflow, policies and procedures, and expected outcomes. Training and education. CityLab should directly train staff involved in the change through thorough training sessions, group discussions, and training videos. Monitoring and evaluation. CityLab should develop goals to measure if the website is successful, which can be measured through staff and relative surveys. In addition, maintenance of the website should be defined and ongoing. By following this implementation, common barriers that health organizations face in adoption and implementation of technology should be mitigated.
Thank you, experts. Well, this concludes our segment. I hope it's been helpful in understanding how to adopt and implement communication tools in long-term care homes. See you all next week.